Since the discovery of HIV in Nigeria, the country's national HIV response championed by the National Agency for the Control of AIDS NACA, has undergone a remarkable transformation. What began as a challenging journey marked by stigma, limited resources, and a lack of awareness has evolved into a comprehensive and unified effort to combat HIV, support affected individuals, and achieve the global goal of ending the AIDS epidemic by 2030. President Muhammadu Buhari's commitment to tackling HIV began at a crucial juncture in Nigeria's journey. Building upon previous efforts, his leadership brought renewed vigor and a strategic focus to address the challenges of HIV head-on.
HIV achievement is measured in the number of people that are living with HIV/AIDS that are identified and are placed on treatment, and the number of people who the program for prevention reach out to, that are aware of how HIV infection occurs, what are the risks of contracting HIV, and how these risks are avoided. When this administration came into power, we had in 2015 less than 800,000 people that were identified, captured on treatment. From 2015 until today that we're talking about, we've identified over 1 million people living with the virus. And we have successfully enrolled them on life-saving medication.
By consistently demonstrating unwavering support for NACA and placing a high priority on improving access to life-saving antiretroviral therapy for all Nigerians affected by HIV, the President empowered the organization to fulfill its mandate and drove the success of Nigeria's HIV response. As a result, more individuals were able to receive the treatment they needed to lead healthier lives.
President Buhari in 2017 made a pledge before the United Nations General Assembly that is going to increase the number of people the government is treating on HIV from resources that belong to the government of Nigeria. And he did that. He doubled.
The president is passionate about the program and has been faithful in implementing that every year. Additional budget to bring more and more people to treatment, because we are talking of human lives here. And about that number die every year. So if we can increase the number on treatment, if we can keep adding on, reducing the number of deaths, because once they are on the retroviral drugs, they're okay. And the viral can come down and they can live a normal life once they keep taking the drugs. And it's money that you need to get the drugs so that our clients, as we call them, we don't call them patients, they are clients, can have access to the medication and they have a regular life like any one of us.
And at the same time, we requested for special waiver for us to buy commodities directly from manufacturers. President Buhari granted. We have had 3 or 4 different events where the president made himself available in person. And this is, all of them were very encouraging because it shows the political will, the commitment that the global community is yearning and looking for, that the office of the president is bringing its weight to bear behind the effort to end AIDS by the year 2030. So far, so good. Nigeria is now being seen globally as global leader in the fight to end AIDS, and the drive has been very vigorous in terms of the energy that involve investment, resources that is being put there, approvals that are given there, and everything that you can consider as support to ending AIDS, this administration has provided.
Acknowledging that a robust healthcare system is the cornerstone of an effective and sustained HIV response, President Buhari's administration implemented far-reaching reforms aimed at strengthening healthcare infrastructure, enhancing capacity, and improving service delivery across Nigeria.
There has been expansion of treatment centers across the country. We have now over 2,000 sites across the country where this treatment is given and is given free of charge. Wherever you have treatment services, you also have prevention services attached to it. There are additional places where prevention services are taking place that are not necessarily sites where we do treatment. And these are sites that, in addition, you have what we call prevention of mother-to-child transmission, PMTCT, and the traditional prevention among the general population, and also prevention among key affected population, as well as prevention programs for adolescents and young persons. These activities have been scaled up all over the country. For KP programming, we have had tremendous growth from about less than 20 sites, I think when this administration came into power, to now over 100 sites all over the country. Yeah.
President Buhari's administration prioritized evidence-based interventions and adopted a holistic approach to transform Nigeria's HIV landscape, with initiatives such as the National Data Repository in 2017 and the Nigeria HIV/AIDS Indicator and Impact Survey in 2018.
An area we feel exceedingly proud to have worked with NACA on is on the issue of data. For the longest while, we really were flying in the dark in Nigeria, not knowing how heavy this burden of HIV is. So it was a thing of joy that we were able to work with NACA to mobilize our development and donor partners, particularly the American government. I will keep talking about the American government, PEPFAR, and Global Fund, for about $100 million to be spent to conduct the largest HIV survey ever done anywhere in the world in this country in 2018. It's called the NICE, Nigeria AIDS Indicator and Impact Survey. It's the most amazing thing that has ever happened in this country. It's a game changer. It was launched by His Excellency, the President, and since then we have revised strategies of how to fight HIV in this country, and we're winning.
Before the NICE, there was a plan for National Data Repository System to look at how we follow up on our patients that are on treatment, and how we measure or monitor progress in terms of their ability to get this virus suppressed. When this virus disappears from the blood and is not seen, it means it's not transmitted. There is no way we can know whose virus has disappeared and whose virus is still there without having the data. Because of that, we created that system, National Data Repository. And after NICE, we found the National Data Repository, NDR, system very effective in terms of getting the count of people living with HIV/AIDS that have been identified and are on treatment, and they are followed up on treatment, and how they are doing on the treatment program. Before, we don't have this information. The power that you get from such information is that it helps you with decision making. You look at what is happening and you decide where next to invest, what to invest on, and where are we in terms of our progress towards epidemic control and ending AIDS.
Under President Buhari's leadership, NACA underwent a transformative decentralization process. 6 regional offices were established to bring localized support and targeted interventions to the forefront of Nigeria's HIV response. This strategic move enhanced community engagement, improved coordination, and bolstered the effectiveness of efforts to combat HIV across the country.
Zonal offices have been created, 6 of them during this administration. I must pay tribute to the former DG, Dr. Sani Adiu, who started the process until current DG came on board. I do pay visits occasionally to the zone in Lagos, the zonal office in Lagos, where I reside. And I know that overseeing 6 states, Lagos, Ogun, Oyo, Osun, Ekiti, and Ondo. And they are doing their bit. They're doing their bit to make sure that the message goes to the grassroots. Because it's the community really that will have these challenges. And it's important that the communities feel that impact.
Basically, the zonal offices were actually created to represent NACA at the state level. And our major responsibility is to support the state agencies to fulfill their mandate. And our activities are actually around helping the states to also organize their state level coordination meetings. We have a lot of technical working groups, the MIA technical working group, the prevention technical working group, the treatment technical working group. We also support the states in the conduct of SACA, IP, coordination meetings and forums in the state. Our job also is to support HQ in making sure that activities, programs that they have designed in HQ are seemingly implemented in the state. And we also provide what we term strategic information to the HQ.
We also mobilize resources. We facilitate the engagement of all the stakeholders, both at the state and the local government, and mobilize. So we also advocate to all stakeholders and the policymakers to make sure enough resources are appropriated, and not only appropriated, but released for them to perform their function in as far as HIV response is concerned within the clauses of state within the zone. Another mandate of establishing is that we are to move closer to the state to oversight their function and provide technical support in all areas of the response, so that the state will hone the response and be at the driver's seat to drive it, as we are aiming towards epidemic control. After the control, that control has to be sustained, and it is the state where the things are really happening at the local level that has to be at the driver's seat, so that they will continue after the donors might have left, so that we sustain the response. So by the year 2030, our 95% UN's target become a thing of reality, even before then.
Amidst the COVID-19 pandemic, Nigeria's HIV response showcased resilience and adaptability. Essential HIV services, including antiretroviral therapy, prevention programs, and testing, remained accessible. The administration of President Buhari's commitment to addressing HIV while navigating the challenges of COVID-19 highlights its dedication to the well-being of all residents in the country.
When COVID-19 struck, HIV laboratories were used to test for COVID-19. We ran HIV testing during the day. At night, we ran COVID-19 samples. And our sample transport mechanism system was used to move samples around for COVID-19, and that makes it a lot much easier. Likewise, the supply chain system was deployed to help COVID-19 response across the country. In addition, the human resources for health, the volunteers we have at the community level and the facility level were all deployed, and they all used their skills to respond or to help respond to COVID-19. So that really helped. And because of that, we had integrated services where we go out in the community looking for COVID and then looking for HIV. When in some communities, no COVID were found, but HIV was found because there was increased access to the services nationwide. Nigeria is, I think, #1 country whose program harvested or yielded growth during the COVID-19 more than any other country in the world, in terms of the number that were identified and brought to treatment who before were not part of our treatment program.
At the peak of it, where there was lockdown, people could not go out to get to health services. In fact, there was a lot of emerging issues because it was a novel virus, so much that we didn't understand. So we had to work with a community of people living with HIV for people to continue to get their stock of medication, even at home. So we work with community of people living with HIV, especially NEPWA Nation, who were like community pharmacists, picking up the agency helped them to get passes to be able to move around during the lockdown. And those who would have been out of stock and not be able to take their medication, and with all of the other complications setting in, that was prevented. And amongst all the PEPFAR countries, Nigeria became the most resilient because we used our established structure to ensure, and we were working along with our COVID-19 colleagues.
The establishment of the HIV Trust Fund was a significant achievement during President Buhari's administration. This dedicated financial mechanism mobilized resources and ensured sustainable financing for Nigeria's HIV response, strengthening coordination and effectiveness in the fight against HIV.
This administration has continued to prioritize health intervention to address killer diseases and public health emergencies. Ending AIDS as a public health threat in Nigeria will require increased domestic funding. We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies.
We found that the private sector has not been too involved. And we know at some point, our partners will leave. The donors are from foreign donors will leave. During this period also, private sector was encouraged to participate in the Nigeria Trust Fund, which the president championed. And the private sector is now involved. People like Dangote, like Access Bank, are championing the cause of the private sector getting involved in supporting the effort, especially mother-to-child transmission.
So what's the background to this? Over the last 2 decades, most of the funding for HIV/AIDS interventions in Nigeria have been undertaken by donor agencies, principally global funds and PEPFAR. About 18% of that comes from government, right? And maybe about 1% from the private sector. What we've seen is that per annum, all the partners have been spending about $500 million every year. And we've gotten to a point where partners are beginning to say, you know what, we've done this for 20 years, it's time we begin to move back a bit, and Nigeria begins to advance and take over a significant portion of the funding. Today, within the physical space in Nigeria, government doesn't have the capacity to do that. And it was on that note that NACA propositioned Nigeria's business community. So based on this, now the HIV Trust Fund of Nigeria was set up. The idea behind the HIV Trust Fund of Nigeria is to aggregate, to mobilize resources from the private sector towards this intervention. And then, you can imagine that $500 million is not a joke. So even the private sector itself cannot begin to take on that level of commitment. So the board of the HIV Trust Fund of Nigeria decided that they would take an aspect, look at the entire thematic space and take just an aspect of it. And they felt that it was important that we take the aspect that most people struggle with. And today for Nigeria is the prevention of mother-to-child transmission of the virus.
Nigeria, under President Buhari's leadership, expanded access to testing and counseling services, overcoming challenges and taking significant strides in identifying and supporting individuals living with HIV.
We really need to recognize the remarkable progress, so that government at the federal level and then at the state level, when those bodies, with the support of partners, the UN, Global Fund, PEPFAR, and others, have made. Nigeria is a resourceful country faced with different challenges, but I'm sure working with the government, federal level, state level, civil society organization, other partners, Global Fund, PEPFAR, the communities, and then all relevant institutions, I'm sure that we will be able, to end AIDS in this country. And if Nigeria is the biggest, and the largest in terms of economy and in terms of population, I think if we get it right, so Nigeria will and can, lead and then show the way, to other countries in the entire sub-Saharan Africa.
Since this program started in earnest in 2005, 10 years down the road in 2015, the achievement that President Buhari made, particularly in the last 4 years, has exceeded what President Buhari inherited. Because of that effort, Nigeria is now very close to attaining what we call HIV epidemic control. All things being equal, in less than 18 months from now, the global community will come to see with evidence that Nigeria has finally achieved HIV epidemic control, and we are well on course to end AIDS before the year 2030. AIDS as a public health problem or disease of public health concern by 2030.
President Buhari's unwavering commitment and transformative impact in the HIV response have left an indelible mark. His legacy will be remembered as one that broke barriers, empowered communities, and set Nigeria on a trajectory towards an AIDS-free generation.